Please welcome our panelists as well as our moderator, Debbie Smith. Thank you so much. Thank you. Can you hear me? Is that good? Okay. Well, we're going to go through some questions, and then we're going to give you an opportunity at the end to ask some questions of the panelists. So we'll just get started off, and we'll ask, why don't we start with Kim and Carla? If we could have you maybe tell us what some entry-level opportunities that students can target while they're still in school.
Sure, definitely. So I think we have a real variety of opportunities in Aurora Healthcare. You can start in food and nutrition services, and if you're interested in gaining patient care experience, food and nutrition services is an area where you can definitely have that patient contact. Environmental services, transport is also a way that you can gain a lot of patient contact experience. Also, a lab assistant would be a great way to start in healthcare as well.
Can you hear me? Okay, great. Entry level, well, we have, in our clinics, we have administrative roles. We call them patient care coordinators or dental service representatives. That's a great place to start because you start to get some patient interaction. But we do also do affiliations clinically with the dental assisting students as well. So we have a lot of students that work in our facilities and get hands-on experience. I know there's a lot of requirements that you have to get so many hours in before we can actually hire you on, but it's definitely something that we've done before and let the students work for us part-time while they continue their programs and complete their programs, and then they start with us full-time.
Okay, great, thank you. So Patrice and Chris, what would be your advice for a student starting his or her career journey?
Well, starting his or her career journey, I would look for a company and an entry into opportunity. And opportunity to see more than maybe just what I am heading out to study. So Fresenius is a global company that has a pharmacy lab and research as well as being a dialysis provider. So you can come in and we can train you to be a dialysis technician. We can also train you to be a biomedical technician who those folks help run the clinics and they monitor the facility and all of the equipment and repair all of that. So there's a lot of on-the-job training available. And sometimes you don't know what you don't know. Because you're not in that field, you're not exposed to what opportunities or what kind of roles those positions fulfill. So just reach out and start. Make a connection, go visit. We will do job shadowing so you can see what other roles are available in the clinic. As I was talking at the table, one of the young ladies is more interested in healthcare management. Well, our admins in our clinics actually are very involved with helping patients and the social workers and the managers navigate through insurance concerns. They do some reporting to the government. Also processing of labs in the clinic and helping with patients and the clinical staff. So that role covers all kinds of different aspects to the day and out. So keep your mind open and just start out.
Thank you. Thank you. Chris, do you have anything to comment on?
Yeah, that was well stated. I would say, just to second off that, in general, I think employer is very important. You want to part of the culture of that employer. What do other employees have to say about that the organizational type of sort of surroundings with the employer. Be open, as it was stated already, be open to different types of experiences. If the employer is something that you really see a fit, step into different types of career paths or exposure to get your foot in the door. And then, like Aurora Advocate has entry-level positions, so does Freighter in the Medical College of Wisconsin, so you get your foot in the door. And then once you're in the door, you can start to be exposed to all the different opportunities within healthcare that the healthcare organization can offer. And you also want to make sure you're doing, you are making the right career choice, so that's why it's be a sponge in the beginning, absorb everything that's open to you, and just go explore.
Well, thank you, that's great advice. April and Natalie, what are some key skills that you are looking for in a healthcare professional?
Definitely a willingness to learn. Hiring for our campus, we may have people that are brand new, and also people that have worked at many other facilities, and every facility functions differently. So definitely willingness to learn and jump in and learn the culture of our facility and how they work together. Also, teamwork is a big one. Any position you have in healthcare, you're going to be working as a team. So definitely working together, whether it be helping someone pick up the slack if they have a lot to do that day, but working as a team and helping out when needed, and definitely professionalism. We are here to serve those who may be in need, or like for me at Village at Manor Park, we are serving residents who are aging. So we really want to be an advocate for them and be professional in the best sense.
Thank you.
I would reiterate everything that Natalie said, and just add dependability is a huge thing in healthcare. We have patients depending on us, and so we'd like employees that we can depend on also, that we know that you're going to be at work when you're supposed to be at work. I know it's a very simple thing, but I just wanted to reiterate that. Engagement is also a big thing on the job. Like, I love my job. I love what I do every single day, and I love that energy when I go in and I talk to my team, and they're engaging with each other and with other departments. And then just being resilient. With frequent job changes, especially in healthcare, we all know things change from a day-to-day basis, sometimes an hour-to-hour basis. Policies might change, procedures might change, and just understanding that that's just kind of the way healthcare is. We're always improving, we're always getting better, and that resiliency really goes a long way.
Okay, good, thank you. Okay, this is an interesting question. What are the must-haves that you're looking for on a resume? We'll ask Kim and Carla to address that.
So I'd say number one is to make sure your employment dates are accurate. So your employment dates obviously are part of what tells your story, part of your journey through your career at this point. Also, make sure that you include volunteer experiences as well as employment experiences. That's definitely a part of your story and a big part of who you are. Let's see. And oh yes.
She said making sure your employment dates are correct. Any gaps in employment as well. Even if it's, you left to, you don't necessarily have to put them on there, but be prepared to answer it. If you, I have people that put, I became a stay-at-home mother. Wonderful. It kind of explains that gap. Or I left to take care of an ailing family member. You don't necessarily have to include that, but be prepared to answer to that. And also highlight some of the things that might not necessarily, people might not necessarily think pertain to the job, but are skills of yours, such as being really good with numbers and those types of things. Those are things that make you stand out from other people, and could be a key indicator for us to look at you further.
And definitely don't be afraid to put things down that you think may not be related to the current job you're seeking. Sometimes when I'm talking to job seekers, we'll go over the different jobs on their resume, and we'll go back maybe 2 or 3 years, and then I'll ask, well, do you have any work experience before this? And they'll say, well, yeah, but it's unrelated because I worked in manufacturing, or I was worked on an assembly line. But that actually is related. That tells something about you. It tells something about that you're a stable, that you'll be a stable employee. But it tells your story, and we'd like to know your entire story.
Okay, great, thank you, great advice. So this next question, I think we're going to divide it in half. This is for Patrice and Chris. What are the top do's in an interview? The top do's.
Do some research on the company that you're going to be interviewing with, or even the person that you're interviewing with, or the position you're interviewing for. So you have some questions ready to ask and can speak to, not as an expert, but as someone who's curious and has a questioning mind on what it is that you're going to be doing then in that role with that person or with that company. Do be honest. If the role is that you're going to be working 4 days a week, 10-hour shifts, and you really can't do 10-hour shifts, then don't say you can do 10-hour shifts. And if it starts early, really early in the morning, and that's really going to be difficult for you, then talk about other alternative schedules, but don't agree that you're going to be able to do that when you can't. It just makes it easier, and you don't know, like I said, you don't know what you don't know. There might be other opportunities that fit perfectly. So just be honest.
Good, thank you. Chris, any do's?
Yeah, I'll add, one of my big pet peeves is the question piece. So make sure you come prepared, do that research, have those questions. I'm interviewing individuals, and the individual should be interviewing us as well. So that's a big piece to that. Be present, be engaged. You know, if that's very easy to tell in an interview if someone is outwardly not wanting to be there, and so then that sends obviously a different type of message. And then just, it's professional. You know, you've worked hard to come to this point to get an interview, so represent yourself well from an appearance standpoint, and show that you want to be there through dressing appropriately for an interview as well.
Good, thank you. Okay, April and Natalie, what are some don'ts for an interview?
I would say don't get too personal. We do care about you as an employee, but in the interview process, I would say there's certain things to keep to yourself. And if they do come back where you need to talk about them at a later date, that's appropriate. But definitely being able to censor yourself.
That, yep. I go through a lot of interviews, so probably about at least one a week right now. Where you know, I would maybe add a don't. And maybe it's kind of a do and a don't, but we've all had negative experiences on the job. So when you're asked, frame your answer in a way that you can spin that negative into a positive, and how that was a learning experience for you. Yeah, basically just how you learn from that experience. We all know we've had some, you know, some difficult or trying moments. That's universal. So just spin it into a positive. Tell your interviewer how you learned from that, and then just like kind of move on to the next question. Yeah.
Great. Very good. All right, starting with, we'll go back to Kim and Carla. Would you mind sharing what your career pathway was?
Sure. So I actually have a bachelor's degree in Spanish, believe it or not. So I love to speak Spanish. But after college, I quickly moved into a career within human services, because I found that I was able to use my Spanish-speaking skills within human services. And I moved into a role where I was able to assist individuals with their job development, their job goals, you know, how to seek employment that was the right match for them. And then eventually through some professional organizations, I found my way to human resources, which in the end has felt right to me, because I've been within human resources for over 19 years, and I'm passionate about career development and helping individuals find a good match for them career-wise. So.
Thank you. Sure, Carla.
So I have a degree in business and a minor in accounting, and I started out right out of college working for a small family-owned company that sells technology to businesses, so you know, computer systems to schools and phone systems. No background in that whatsoever, but they gave me a job, And the company was fantastic. I just didn't have a knack for it. I liked technology, but I did not like selling it. So I was looking for something else, and it was my boyfriend's sister at the time, now my sister-in-law. She worked for Dental Associates. At that point, she had probably worked for Dental Associates for about 15 years as a dental assistant. And they were looking for somebody to be their implant treatment coordinator, to help sell implants to patients. To what Kim said earlier, don't be afraid to put something on your resume that you might not think will relate. They liked that I had a sales background, because there's an aspect of that to getting patients to buy into treatment. So that's how I started off at Dental Associates, and I quickly grew from there. I did that job for a couple of years. I was the administrative assistant for the Green Bay facility for less than 2 years, and then I moved into a supervisor role, which had its challenges because the staff I was once working next to, I was now supervising. Luckily, they were all great staff, and it was somewhat of an easy transition. They made it an easier transition. And then from there, I was growing, and I wanted something different, but I wanted to stay with the company. The company has been around for over 40 years, and it's family owned, and there's a lot of great value to it. So I spoke up and I said something. I said that I want to stay here. I'm good at what I do, but I don't have as much of a passion for it anymore. And luckily for me, they found a role for me. They kind of created a role. It kind of started as a hybrid and started to change and evolve from there. All because I spoke up and I had people behind me that were in support of me doing something different. And it's turned out beautifully. Kind of like Kim as well, I went into the HR world, and it's been a couple years now, and I absolutely love it. I love recruiting. I like all of the aspects of the new technology that we can use and different ways to get in touch with candidates, but I also like being able to have good relationships with not only our technical schools in the areas, but now we're getting into youth apprenticeship programs with high schools as well. And I recently helped develop a more formalized process for job shadowing as well. We have a lot of staff members that are like, oh, my cousin thinks they want to be a hygienist, can they come and shadow? Or a patient that says, oh, I think my daughter wants to be a dentist, can they come shadow? Well, there's a lot of liability things that go into that, and patient records and things of that nature that you have to be careful of. And we never really had a formalized process, but I felt it was very important for these young students to be able to help find their pathway and what they wanted to do. So I'm excited that that's been rolled out. We'll be able to do it on a more regular basis with students that aren't part of any programs yet, but are trying to figure out what they want to be a part of.
Well, that's great. What a wonderful opportunity for those people looking. Great. Patrice, could you tell us what makes your company a great place to work?
Oh, opportunity. That, hands down, opportunity. There are different options and career pathways. Just get in. We will train you in technician roles, which is usually where folks start, or in a clinic admin, or the biomed position. We will teach you, we will train you, and we will help you with tuition reimbursement. And like I said, there's many different facets to the company and locations all over the globe. So really, your opportunities are endless.
That's great. Great. Chris, what makes your company a great place to work?
I would have to second that. There's a ton of opportunity within the organization. We have a footprint from north of here up in West Bend all the way down to now the Kenosha, Racine area. There's a huge focus within Freighter around career development. So there's a whole department around entitled organizational development, and a portion of that allows existing employees to outreach to them and say, you know what, I really need a career change, but I want to stay with this, I want to stay with the organization, and they work with them to help place them within the organization, but maybe in a new role. So there's a huge focus on that. It's a team of at least 5 individuals that do that for our employees, and it's been well received.
Thank you. Natalie and April, the advancement opportunities or progression within your companies, could you speak to that a little bit?
Sure. So, our community has a big nursing need. So that comes down right from, resident assistants. So to be a resident assistant, you just have to be CGRAF certified. You can then receive your license as a CNA. You can then go from being an LPN to an RN. And then once you're an RN, it kind of opens the gates into what you want to do. We have, an admission discharge nurse. We have supervisors. Then we have clinical coordinators who oversee each unit. We also have wound nurses who strictly do wound care on staff. We also have a team of nurses that is our admissions department, so working with residents on having them come in from different facilities, whether it be hospitals or assisted living into skilled nursing. And then overseeing, being the director of nursing, and then moving up to being a CEO or president or administrator of our facility is just kind of what the nursing realm looks like. But each department kind of has their own career path within it, multiple steps, whether you're gaining experience and knowledge or whether that be more schooling. So there really is a career path for each department.
Thank you.
Same question? Working in a lab, there are many job pathways that you can go. There's histotechnologists, cytotechnologists, lab assistants. So I guess the starting would be a lab assistant and or phlebotomist. Then there's medical laboratory technician would kind of be the next step. Medical laboratory scientist, which requires a 4-year degree. I can take my own career pathway as an example. I started off as a bench technologist with a 4-year degree and am now in management. One day I would love to be a director. So there's so much that you can do in a laboratory setting or with a degree in medical laboratory technology like you would get here at MATC. You don't have to stay in healthcare, but you can take that degree with you many places.
Always opportunities.
Always.
Yeah, that's great. That's great. Speaking of opportunities, professional development. Kim and Carla, what kind of professional development opportunities do your companies offer?
Sure. So Aurora offers an excellent tuition reimbursement program. So whether you're looking to pursue further education related to your current field, or even if you're looking to go back to school for a totally different career, as long as it's related to something at Aurora Healthcare, we do have tuition reimbursement available. And that is available right away upon your start at Aurora. In addition to that, we do have an organizational development department that offers really just an array of different classes available to employees. It can be anything from if you want to improve your leadership skills, if you want to improve your public speaking skills, let's see, problem solving skills. So they're free of charge to employees. And our leaders at Aurora are very supportive of you taking these classes, and it's encouraged. When it comes to professional development too, we're a very large system, and it's very easy to transfer within our system to other opportunities, whether it's advancement within your own department, or whether you're moving to a different city or even a different state. Within the last year, we've actually merged with Advocate Healthcare, and so now we do have people transferring and moving within the system between Advocate and Aurora Healthcare, between Wisconsin and Illinois. And we definitely promote from within. So once an employee is with us and is a great performer, then we're definitely going to do everything we can to help someone learn and grow. I like to tell people that when it comes to learning and growing, that doesn't just mean moving into a different job or into a different department. I think one thing that's really important to do is to take the opportunity to take on special projects or volunteer to learn new things in your own department. You know, if there's something that you're passionate about that you see going on in the department, I mean, definitely raise your hand and see if there would be an opportunity for you to help. So.
Great, thank you.
At Dental Associates, we also have a tuition reimbursement program, which is great. I know a lot of people take advantage of that while they're working for us, and it helps them further their education. Internally, we do a handful of things as well. We do have a training department, which is great. We do some structured training when we have new staff start with us. But that training team is also available to go on site as well. Sometimes we have facilities that call and say, you know, we're having some struggles with staff taking x-rays. Can you come and do some workshops with us? So we'll do things like that within your regular day-to-day and help with those skills. We're actually working on a more structured program on a couple levels, both for our support staff and for our management staff. We utilize a tool called Bridge, which is a learning platform, and it has great tools within it. We can develop our own programs as well, which we've done some of that. But we, as a company, we have objectives. And we're kind of doing something a little bit different with our objectives this year for the company. We have objectives that have a team, and they're not just everybody from our home office. There are people from our clinics, there's people from patient financial services. We've kind of wanted kind of wider spectrum to get everybody's input, and one of those objectives is based upon learning. So what we wanted to try and do with that is look at our current supervisors and practice managers and team leads and say, because we do promote a lot from within, I think it's over 80%. Whether you came from outside or you came from inside, what did you need that maybe you didn't have when you started? What do you maybe still need? And take that, we've actually sent out a survey and develop a course program for our staff members in Bridge. But not only, like I said, on the management side of things, but also on our support staff side as well. So there's different programs that you can take out there if there's certain skills that you want to learn. Again, off of what Kim said, there is opportunities for you to kind of expand if you have an interest. If you're familiar with the dental field, there's a lot of different areas. We have general dentistry, pedodontics, which works with children, ortho. Dental Associates actually has all of them. So having staff members that are interested in cross-training and learning those additional fields is great. It helps when somebody calls in sick and they can help fill in. It just makes you a more valuable employee as well, where you can jump in and you can help out where need be, because we like to work as teams. Absolutely.
Okay, thank you. Thanks for the information. Patrice and Chris, what type of benefits does your company offer?
Well, Fresenius offers the basics, health, dental, 401k, there's paid time off, all those things. But there's also then opportunities for discounts in purchasing vehicles or phone plans or memberships to Weight Watchers was in there. There's all kinds of different, these miscellaneous cool little benefits that, yeah, you have like opportunity to take care of. A good, it is a good medical plan. It's a good savings plan. You're asking one of these questions. I'm not good at using all that's available to me, that's for sure. I have looked some of them up, but there is quite a list. It's got a full backing as a company, so there's a nice package there.
Great, great.
Yeah.
Chris, what about your company?
Yep, with Freighter, same with the medical coverage, dental. Freighter does have a pretty competitive tuition reimbursement program for our employees, retirement, and proactive contribution by the employer into your retirement savings if you're actively contributing. And then there's those other more discount type benefits, similar to that, where you can get percentage off on phone plans, auto loans, auto type things. Freighter is a proud partner of the Milwaukee Bucks, so we do get discounts at times around event type things. And then I'll also interpret benefits as I'll speak more on the pharmacy side of things with regard to, from a pharmacy perspective, we are a 700-ish employee department. And we're open 24/7. So from a benefit of scheduling piece, we do have different types of work schedules that can meet most anyone's work schedule, from first shift, second shift, third shift, no weekends type of thing, full-time, part-time.
So that's nice. Great. Natalie and April, although you all may want to contribute to this question, are there volunteer opportunities available with your organization?
Yes, we are actually considered a nonprofit, so we have quite a large group of volunteers, over 500 I would say. We work directly with MPS too and have students that come in and do part of a work program where they're able to kind of help out in different departments, as well as anyone in the community. So Bonnie, she's our volunteer coordinator, has been with us for over 15 years, and she's really great at placing people where their interests lie and also where we have a need. So she kind of goes over the facility as a whole and what would work best for you and your hours and kind of what you're looking for long term in relation to volunteers. But yeah, we definitely do have a big volunteer presence on campus with us.
And I'll say, yes, Wisconsin Diagnostic does. I will, if Chris is going to answer all, because Wisconsin Diagnostic Laboratories is owned by Freighter, so we're able to tap into those resources. We're actually doing our United Way campaign right now. But Wisconsin Diagnostic Laboratories, we have our own, it's called Caring for Our Communities Committee. So we have our own committee that puts on all kinds of events. Our partners with so many events. I can't even name them off right now. I can't even think. Because I want to talk about the one thing that I'm super passionate about, and that's our partnership with Junior Achievement. I spearheaded this campaign. We show up and we inspire young minds about science and healthcare, and we let them know. We do elementary, middle school, and high school presentations. It's me and one other person, and we have a career ladder at Wisconsin Diagnostic Laboratories. So depending on your years of service and knowledge, and what you learn as you grow with the company, you move to like a step 2 and a step 3. As part of those requirements, you have to do presentations. And so we include we let one technologist come with us on any one of these career day presentations, and they get to interact with kids and just kind of inspire young minds.
Oh, that's great.
It all started with me doing career day at my daughter's school, and then I partnered with Junior Achievement. I'm like, let's do all of your events for you.
And look what it morphs into.
Yeah, it's so much fun.
That's great.
Yeah. Exhausting. I could never be a teacher. So to all the teachers out there, you guys are amazing, and thank you very much for what you do.
Great. Anybody else with volunteer opportunities?
Yeah, I mean, at Aurora Healthcare, we have a volunteer services coordinator that's dedicated to almost every major hospital that we have, and really that volunteer services coordinator spends a good amount of time interviewing that individual to find out, what they're passionate about, what really excites them, because if they're passionate about something, that's where they're going to find the most enjoyment and be better assistance to us, of course. Actually, just last week, I was working with one of our volunteers she really enjoys working with the public. She enjoys working with patients, and so she dedicates most of her time to working in the oncology department at our medical center in Sheboygan, but she's open to all different types of experiences, so she spent all day helping us at an open house career event last week, and she was amazing, and we couldn't have done it without her. We have people who are passionate about their pets, and so they want to bring their pets in and to visit patients, and patients love it. Let's see. Oftentimes when individuals are thinking about a career, maybe they have a friend or family member that's in a specific career, they'll talk to volunteer services about it. We had a young man who thought he may be interested in a laboratory career, and so he volunteered within our laboratory at Aurora Medical Center in Summit, and he did an amazing job, and he ended up eventually becoming employed as a laboratory assistant. So it's actually also just a nice way to try Aurora Healthcare out, by volunteering with us first and to decide if it's a good culture or place for you to work at. And at the same time for me, when we have some of our dedicated volunteers, I often reach out to them too to find out if they're ready for a paid position. So yeah, I mean, really the opportunities are endless.
Great, thank you. Thank you.
Fresenius locally has been primarily involved with the National Kidney Foundation in our volunteer efforts. So in supporting or sponsoring their community walks or events. Recently we partnered with the National Kidney Foundation, who linked us to a screening, a patient screening for blood pressures and blood sugars, and we brought in a couple of nurse practitioners so they could do an evaluation of the patient, and it was at a local food pantry. So that was a nice opportunity. So we're always looking for ways that we can reach out to the community.
That's nice, yeah, be a part of the community, great. Here's another question that maybe several of you have want to respond. Do prospective employers look at social media profiles before hiring? Okay, so Patrice is really nodding her head.
Yes, they do. I don't know, there's more than you need to say. Don't post.
I mean, I would say even when it comes to Facebook, I mean, if you're out there looking for a job, consider what you have on Facebook. I mean, I'm not saying I'm looking at all my candidates' Facebook pages. Like, definitely not. I don't have the time for that. But I know employers do. I often have candidates connecting with me on LinkedIn. And, so often individuals think of that as more of the professional platform for social media, but yeah, I'd say definitely, even when it comes to, Twitter, Facebook, and every other social media platform, think about how you're representing yourself, because employers will probably notice.
I can't speak to all of our facilities, I know some definitely do. But yeah, if you're putting it out there, just be cognizant of that. Same goes for actual employees as well. There's sometimes we run into sticky situations, taking a photo within a clinic or something like that. There's HIPAA violations and things. So on both sides of it, making sure that you're professional. You still have the right to say and do things that you want to do, but just make sure it looks good on the outside.
Okay, good advice, great advice. Anything to add to that? I pretty much said it all, right? Okay, great. Well, I think those are the questions that I have here. I think Alyssa wants to see if there's any questions from the group.